Has your baby ever just finished feeding, only to spit up soon after, or had diarrhea so frequently that you can hardly believe how often you're changing diapers? Do you feel anxious each time, wondering if your baby is sick, or if you're doing something wrong when feeding them? As a new parent, these situations are common, but there's no need to worry too much. In today's video, we will discuss the common causes of spitting up and diarrhea in newborns and share some simple and practical feeding tips to help you manage these issues. By the end, you'll feel more confident tackling these challenges and supporting your baby's healthy growth. Spitting up is something that often catches new parents off guard. You might think, why is my baby spitting up? Are they uncomfortable? Is this normal? Actually, spitting up is quite common, especially shortly after feeding. This may cause some confusion and concern for parents, but don't worry, spitting up isn't necessarily a bad thing. In many cases, it's a natural part of your baby's development. Reason 1. Swallowing air. A newborn's digestive system is still underdeveloped, which makes it easy for them to swallow air while feeding. You can imagine that when your baby sucks in air along with milk, this air gets trapped in the stomach, increasing pressure and causing your baby to spit up as a way to release it. So, swallowing air is a major cause of spitting up. What can we do about it? 1. Adjust feeding position. Try changing the feeding position to keep your baby's head higher than their stomach. This position helps reduce air intake and ensures the milk flows smoothly into the stomach, reducing the chances of spitting up. 2. Burping. You may already know this, but burping is really important. After each feeding, gently pat your baby's back to help release the trapped air. Don't rush, sometimes it can take a few minutes, but this is one of the most effective ways to reduce spitting up. 3. Choose the right nipple size or feeding pace. If you're bottle feeding, make sure the nipple size is appropriate for your baby's age. If the hole is too large, the milk might flow too quickly, causing your baby to swallow too fast and take in air. Choosing the right bottle and nipple size is key to minimizing spitting up. Reason 2. Gastroesophageal reflux. If your baby spits up frequently and in large amounts, you may want to consider another common issue, gastroesophageal reflux. Simply put, this occurs when stomach contents flow back into the esophagus, irritating it and causing your baby to spit up. A newborn's stomach valve hasn't fully developed, making them more prone to this. However, there's no need to worry, as this often improves as your baby grows. In the meantime, here's what you can do. 1. Feed smaller amounts more frequently. Your baby's stomach is small, so eating too much can cause discomfort. Try feeding smaller amounts, but more frequently to help your baby's stomach digest the milk better. 2. Watch for food allergies. Some babies may have sensitivities or allergies to certain ingredients in breast milk or formula, which can cause indigestion and spitting up. If you suspect your baby has a food allergy, it's best to consult a doctor. They may suggest switching formulas or adjusting your diet. Most cases of spitting up are normal and harmless, but sometimes spitting up can be a sign of a more serious health issue. If your baby shows any of the following signs, it's important to seek medical attention. The spit up is brown or green. This could indicate blood or bile. Spitting up is accompanied by severe crying or obvious discomfort. Poor weight gain, where your baby's weight isn't increasing over time. These signs may suggest that there's a more significant issue with your baby's digestive system that requires medical intervention. Now, let's talk about another issue that makes many parents anxious: diarrhea. If you notice that your baby's stool suddenly becomes watery and the frequency of bowel movements increases, you might be worried. Is this normal? Is diarrhea a sign of illness? In fact, a newborn's digestive system is very sensitive and many factors can cause them to have diarrhea. Reason 1. Immature intestines. A newborn's intestines are not fully developed yet, which means they are more prone to diarrhea. For parents, This doesn't necessarily mean the baby is sick, but more likely that their intestines are adjusting. However, diarrhea can make your baby feel uncomfortable, so we can help alleviate this situation with some dietary adjustments. 1. Breastfeeding. Breast milk is the best food for newborns. Not only is it easy to digest, but it also contains natural antibodies and probiotics that support your baby's intestinal development. If you're breastfeeding, try to continue, as it can help reduce the chances of diarrhea. To avoid introducing solid foods too early, some parents are eager to start introducing solid foods to their baby. However, before 6 months, your baby's primary source of nutrition should be breast milk or formula. Introducing solid foods too early may overload your baby's digestive system and cause diarrhea. Reason 2. Food intolerance or allergies. Another common cause of diarrhea is food intolerance or allergies. For example, a baby who is lactose intolerant may experience indigestion and diarrhea after drinking formula containing lactose. In this case, you can try the following. 1. Lactose-free formula. If your baby is lactose intolerant, choosing a lactose-free formula is a good solution. It can help your baby digest better and reduce diarrhea symptoms. 2. Adjust the breastfeeding mother's diet. If you are breastfeeding, try adjusting your own diet by reducing foods that may cause allergies, such as dairy, eggs, and nuts. Reason 3. Infection-caused diarrhea. In addition to food intolerance, diarrhea in newborns can also be caused by viral or bacterial infections. Infections like rotavirus or gastroenteritis can lead to diarrhea along with other symptoms such as fever or vomiting. To help alleviate infection-caused diarrhea, here are some tips. 1. Hydration. Diarrhea causes significant loss of water and electrolytes. Ensuring your baby gets enough fluids is crucial. You can give your baby oral rehydration salts to replenish electrolytes and prevent dehydration. To continue feeding. Although your baby has diarrhea, don't stop feeding them. Proper feeding helps maintain their strength and aids in recovery. Just adjust the feeding amount according to the doctor's advice. 3. Seek medical attention immediately. If your baby's diarrhea lasts more than 2 days or is accompanied by fever or vomiting, take them to the doctor right away. Diarrhea caused by infections requires professional medical treatment. You might feel that your baby's digestive issues seem difficult to control. Actually, observing and keeping records is a very important tool for parents. By carefully recording your baby's feeding and bowel movement patterns, you'll have a better understanding of their digestive system, spot potential problems early, and make the necessary adjustments. So, how should we keep these records? 1. Feeding records. Record the time and amount of each feeding, and note if spitting up occurred afterward. 2. Bowel movement records. Record the number of bowel movements each day, any changes in the color and consistency of the stool, and whether diarrhea occurred. 3. Signs of discomfort. Observe if your baby shows signs of distress after feeding, such as crying or burping. With these detailed records, doctors will also be able to quickly and accurately assess whether there is a digestive issue that needs to be addressed or if simple dietary adjustments can help resolve the problem. In conclusion, spitting up and diarrhea in newborns are quite common. In most cases, with proper dietary adjustments and attentive care, these issues can be effectively alleviated. Remember, as a new parent, patience and attention are the most important things. Be there for your baby and support their healthy growth. If you are still unsure about your baby's symptoms, don't hesitate to consult a doctor to ensure your baby's health and comfort. All right, that's it for today's discussion on newborn spitting up and diarrhea. If you found this information helpful, don't forget to like and subscribe to my channel. We've got even more exciting content coming up next time, so I'll see you then.